What's up, everybody? Justin Brock here with the Medicare Coach and aka Medicare Guru. Just wanted to come to you today to show you the enrollment process for National General Short-Term Medical. It's something we've been writing a lot of lately to our even to our Medicare leads, as well as using major medical leads to cultivate some Medicare business from age-ins and from people who have spouses who are over 65. So take a minute to watch this video, and I'll go over the application process just a second. Alright guys, here's what I'm going to show you. First of all, I'm going to walk you right into the portal and we're going to check out what all we got going on here. Hold on just a second. Let's pull it up here. Okay, National General, logging on in. When you come into the portal, it's pretty simple. You got all these other bells and whistles that I never mess with. All I do is come straight in here, talking to a client, and I run a quote based on the zip code. So first thing I'm going to do, zip code 38801, or whatever zip code you want to run. You're going to pop on over here. It's going to pull your zip code up in the county. If you're running a child only major medical quote, you would just click child only. Pretty simple. Then it would, turn it into, just quoting children. I'm going to take that off. Let's say I'm writing just an individual person. If you're writing a whole family, you could put them here with, mom, dad, all the children. I think if you do over 4 children on one application, or over 5 children on one application, you have to call in. But I haven't had that happen. I'm sure it's definitely possible though. So when I go to run this, I'm just going to run one for myself really quick to show you. Let's pop this in here. No tobacco use, male, Lee County 38801. Right now, when you're writing, you're quoting 4 3-month terms. So you're quoting 12 months sold in 4 3-month policies underwritten at the same time. That's the way you'd be doing it. But here after October 1st, because of the mandate ending and the ban lifted on short-term medicals, they will go back to the full 12-month policy. But right now I'm just going to go through the quote with the 4 3-month because it's still a much better option than a lot of what people are paying for out there. So click show plans, and it will come through here and it'll create a package for your state. Okay, so what did I just do there? Boom, sorry. So it'll create a package, and it's going to include dental, short-term medical, accident. I don't know why they did that. I'm guessing they just wanted to see if it would up their cross sales. I don't create this. I go straight to customize. And in customize, I would actually go through here and see and pick out the plan that I would like, the corresponding short-term medical. So the one that I sell a lot of is the $1,000 deductible, 80/20 co-insurance, $2,500 maximum out of pocket. So for me, that's showing $100.40. This is kind of like being on Amazon. You have a shopping cart over here. So the ones that came up naturally from the old quote, you can just exit off of here, and you can add in the one you want. And when you're ready to enroll, don't click the orange create proposal unless you just want to email a quote to somebody. If you want to enroll, you just click straight into enroll now, and we're going to put in an email address, and it's going to move on forward to the to the e-app, and it's going to take forever to load. It typically doesn't, but right now, since we still have the whole Affordable Care Act minimum essential coverage law until January 1st, it's going to talk about that here. It's going to make you, read these and acknowledge them. The deductible and out-of-pocket limits will reset at the start of each new 3-month term. Of course, that's not going to be an issue when they change it back over to 12 months. So you're going to click yes, I agree, and move on. And it's going to come over here where you start putting in the information. So let's just build this out. Justin C. Brock. And I'm going to put my address. You guys come by and see me now that I'm dropping my address. It's actually a little wrong. My address is Belden, so I'm going to have to put Tupelo because that's the zip code I used. Okay, if you're rewriting someone and they've already had National General, you click this and it will waive the enrollment fee. Otherwise, you just click continue here. And then we're going to head on over and answer the health questions. Not any terrible health questions. Now, are you now pregnant? Are you an expectant father? Are you in the process of adoption? Are you undergoing fertility treatment? Are you over 300 pounds if male or over 250 pounds if female? Then you have a last 5-year question. This is your big medical question. Last 5 years, any of these things for cancer, tumor, stroke, heart disease, including heart attack, chest pain, or had heart surgery, COPD or emphysema, Crohn's disease, liver disorder, degenerative disc disease or herniation/bulge, rheumatoid arthritis, kidney disorder, diabetes, degenerative joint disease of the knee, alcohol abuse, or chemical dependency, or any neurological disorder. All that mess. We're going to say no. Within the past 5 years, has any applicant been diagnosed or treated by a physician or medical practitioner for AIDS or HIV? No. Has anybody been hospitalized for mental illness? No. And are you a U.S. citizen? Yes. Okay, got that done. And it also says, if you're not a U.S. citizen, do you intend to live in the United States for the duration of the policy? So technically, you can sell it to someone who's not a citizen. So you get to the payment method page, you can do credit card or bank draft. It's pretty simple. We just put some and moving forward, go right through that. Now, on this policy, they will draft the first month's premium as soon as you submit it. So just be wary of that. They will do that. And the first month's premium will have a $35 enrollment fee on it. That's a one-time fee. When you draft this, when you send this through, the first thing it'll draft will be the $35 enrollment fee, this right here, plus the $15 association fee, which is part of the total monthly fee. So they'll see $50 come out of their statement first, and then they'll see the $85.40. Going forward, they'll see the $85.40 with the $15 monthly fee. As you can see on here, since it resets every 3 months on this one, it would go up about $1 every quarter. Of course, that won't be a thing when they swap it over to the 12-month plans here pretty soon. So we're going to continue on through here. And it says, congratulations, you made it. So I just enrolled myself. I'm sure that one's going to fail because I put in a bunch of fake numbers. But that's pretty much it. What'll happen then is they'll get an email, and it'll have something saying how to finalize enrollment, and or not finalize enrollment, but they'll get an email that shows their member ID, and it'll allow them to create a login where they can monitor claims. It'll allow them to create a login where they can, print off their ID cards, all of that stuff. Now, they do get hard ID cards in the mail, but sometimes it takes a while to get there, so you can show them that. They can put the ID cards on their phone. They can print them off, whatever you need to do. It will ask them to sign an authorization when they log in. However, if they don't do that, the policy will still go into force just like normal. So there's not any real mandatory signature process, although I'm pretty sure National General wants you to do that. So that is pretty much the process on the National General Aetna PPO short-term medical. This one here is going to be very popular come this fall when this goes into the 12-month plan. And being able to utilize that Aetna PPO for marketing will be a huge win. So if you want to add this to your portfolio, your Swiss Army knife, click below and I can send you over the information. The street level compensation on this is 18%, but we do have contracts depending on production levels that we may can get approved of 20, 23%. So we can, depending on where you're at, we can get you a higher level. But typically, if you have no under age 65 health production to prove, you'd be at 18% naturally. But if you click below, you can submit a contract, or you can request a contract. So do that. If you have any questions, give me a call.